Hi, I'm here to perform my incentives parametry. So first and foremost is we always make sure that we check the patient's chart to obtain any important information, and then once we're done, inspect the device. If there are any cracks present or if there is, make sure we should replace it with a new one. So we always make sure we introduce ourselves to the patient, and then we allow the patient understand what we're going to do, such as telling them that this is an incentives parametry. This is therapy that would help your lungs expand even more, which would prevent collapse of your lungs, and then at the same time it would strengthen your diaphragm and make you expectorate if you have any phlegm or sputum present. So before doing this is make sure we check the patient's ID band to make sure they're the correct patient, and then reassess them, obtain vital signs, and make sure you auscultate them before doing this. So after that, we wash our hands, and then when doing this, make sure we demonstrate it in front of the patient, so that for them they would be able to fully understand how to do this device. So when doing this, make sure you set this one, the mouthpiece, and then we have a chart in here that would check if what's the ideal goal for the patient, such as if mine maybe about in between 2000 to 19 to 2000. So we have to set this one up, and then make sure if the patient is comfortable, you can let them sit upright, or if they just came from surgery, you can have a pillow in front of them so that it would help alleviate their pain and relieve them from any pain. So after that, let the patient do exhalation until their lungs are empty. After they feel their lungs are empty, put this one in their mouth, and then make sure that it is properly sealed with the lips. And then once it's sealed by their lips, let the patient take a slow deep inspiration until such this white piston rises up. Once it rises up to the ideal goal, let the patient hold for about 3 to 5 seconds, and then let it drop until when it drops, this will remove the device from their mouth and exhale normally. So this white piston would help open up their air sacs in their lungs. And then once everything is done, if you want to do another attempt, let the patient rest for a few seconds and then do another one. And then make sure that you're able to do this about 10 times, waking hours only, or every hour. And if the patient is coordinated, cooperative, fully awake, and of course is conscious, not unconscious. And then if the patient complains any dizziness or they experience any nausea, terminate the therapy. Make sure they are comfortable. So assuming that we already did this to the patient, put this one back to the plastic container, and then the mouthpiece should be covered with a clean tissue cloth. And then if possible, if we can return after an hour so that we can perform this, so that the patient would be able to have this exercise for their lungs. And then every after treatment, let the patient cough, and then obtain vital signs. Make sure you perform auscultation also, and then if they're uncomfortable, let them be more comfortable before going out. And then if the patient was able to reach their goal, we also of course document everything in the chart, or if not, or if what we're able to observe to the patient, we make sure we document everything, and then communicate with the nurse or physician